Imagine holding the potential for life, frozen in time. This is not just a concept from science fiction, it's a reality made possible through modern science. That's the essence of embryo freezing, a scientific marvel formerly known as embryo cryopreservation. This groundbreaking technology has revolutionized the field of reproductive medicine. This procedure allows us to pause the biological clock, offering hope and options for building families in the future. It provides a unique opportunity for those who may not be ready to start a family immediately. Essentially, embryo freezing involves fertilizing eggs with sperm in a laboratory setting, creating embryos. These embryos are then carefully monitored to ensure they are developing correctly before the freezing process begins. These embryos are then carefully cooled to sub-zero temperatures, halting their development but preserving their viability. This process requires precision and expertise to ensure the embryos remain intact and viable for future use. Think of it as hitting the pause button on the development of these tiny clusters of cells. This pause can last for years and allows individuals and couples to pursue family planning on their own terms, whether facing medical challenges, career aspirations, or simply the desire to delay parenthood. It offers a sense of control and flexibility in an often unpredictable journey. The reasons for considering embryo freezing are as diverse as the individuals and couples who choose this path. Each story is unique, reflecting personal circumstances, medical conditions, and future aspirations. For some, it's about preserving fertility in the face of medical challenges. Medical advancements have made it possible to plan for the future even when faced with daunting health issues. Women undergoing cancer treatments like chemotherapy or radiation, which can impact egg quality, often turn to embryo freezing as a way to safeguard their dream of having biological children. This proactive step can provide hope and a sense of normalcy during a challenging time. Age is another significant factor. The biological clock is a reality that many women face, and embryo freezing offers a way to pause that clock. As women age, the quantity and quality of their eggs naturally decline. This decline can make it more difficult to conceive later in life. Embryo freezing offers a way to capture and preserve fertility at a younger age, increasing the chances of a successful pregnancy later in life. By freezing embryos when the eggs are at their healthiest, women can plan their families on their own terms. Couples undergoing in vitro fertilization often find themselves with extra embryos after a successful cycle. These embryos represent potential future children and the hope of expanding the family. Freezing these embryos provides the possibility of expanding the family in the future without repeating the entire IVF process. This can be a significant emotional and financial relief. It also offers a safety net in case the initial embryo transfer doesn't result in a pregnancy. Having frozen embryos available can reduce the stress and uncertainty of the fertility journey. Whatever the reason, embryo freezing provides a sense of control and empowers individuals and couples to take charge of their reproductive journey. It allows them to make informed decisions about their future. Embryo freezing is not just a medical procedure, it's a pathway to hope, security, and the fulfillment of dreams.